If you have metastatic breast cancer, you already know how overwhelming and confusing it can be. You may have lots of questions. Is your breast cancer hereditary? Was it caused by a mutated gene? There's power in knowing. Everyone carries BRCA1 and 2 genes in their cells. You inherited one copy of each BRCA gene from both of your parents. Normally, BRCA1 and 2 genes work to help repair damage to your DNA, which occurs every day. When you have a BRCA gene mutation, your damaged DNA may not be repaired properly, which puts you at an increased risk for developing certain types of cancer, including breast cancer. That's why knowing if you have an inherited BRCA gene mutation can be important, whether you currently have breast cancer or not. If you have early-stage breast cancer or have had breast cancer in the past, knowing can help you manage your risk for recurrent cancers. If your breast cancer is metastatic, knowing can make you eligible for treatment options that may include chemotherapy, such as taxanes, radiation, surgery, or targeted treatments such as PARP inhibitors. And if you have never been diagnosed with breast cancer, knowing can help you assess your risk and take preventive steps. To know your BRCA status, all that's required is a simple blood or saliva sample that your doctor sends to a lab, where a technician will look for mutations in your DNA. If you test positive for an inherited BRCA gene mutation, your doctor may refer you to genetic counseling, because there is a 50% chance that your children, siblings, or a parent carry the same BRCA gene mutation. Telling them can help them understand their risk for developing certain types of cancer and empower them to take preventive steps, like having routine checkups and screenings that may help detect breast cancer early. Once you know your BRCA status, you and your doctor can talk about next steps and possible treatment options that may include chemotherapy, such as taxanes, radiation, surgery, or targeted treatments. Targeted treatments such as PARP inhibitors have been approved for treating people with a certain type of metastatic breast cancer who have an inherited BRCA gene mutation. So, the sooner you know your BRCA status, the better. First, ask your doctor if getting tested is appropriate for you. If it is, get tested. Then, review your BRCA test results with your doctor. And if you have an inherited BRCA gene mutation, discuss treatment options. It might help to get a referral for genetic counseling to interpret the test results and assess your family's risk. There's power in knowing your BRCA status. And now that you know more about what BRCA genes have to do with breast cancer, the impact a gene mutation can have on family risk, and possible treatment options for metastatic breast cancer, talk to your doctor about getting tested.